Tonight, 13 Investigates has a warning for you. If you think your health insurance will cover your medical bills following an emergency, think again. There is one area of health care in particular resulting in huge surprises. Our senior investigative reporter Bob Siegel tonight shows you the shocking charges you need to look out for and what's being done tonight to stop them.
Good morning.
Come on in.
This is a weird morning for Ryan Thedwall. He's a longtime photojournalist at 13 News. But on this day, Ryan is not shooting the story.
Remember how to use that?
He is the story. Not just Ryan, also his wife Erin and their son Teddy. What a year it's been for Teddy.
Teddy was there for 29 days.
29 days in the hospital. It all started while the Thedwalls were on vacation in Chicago. First a cough, then trouble breathing.
And you could just feel his heart just absolutely thumping like crazy fast, like a hummingbird. And that was when we realized he needs to go to the hospital.
But the pediatric ICU at Lake Forest Hospital was full.
The ambulance was on the way, was the first thing they said to us, to transfer us to another hospital.
So I rode in the ambulance with Teddy.
Over the next few days, Teddy got worse. A lot worse. His lungs were failing.
He was near death. It was bad.
A ventilator and eventually life support gave Teddy's lungs a chance to recover. Happy birthday to you. Today, Teddy's doing great. No real signs of his scary summer, except for a surprise that arrived in the mail.
Yeah, we got a bill from the ambulance, over $8,000.
$8,470.
The ambulance that transported Teddy 19 miles between hospitals was not in his parents' insurance network. So the Thedwalls got a huge bill to cover what insurance would not.
Did the hospital explain to you that they were calling an out-of-network ambulance?
Nope, they said transportation is on the way.
Did you have a choice of what ambulance company was going to transport your son?
Obviously not. At the time,
yeah.
Didn't even give it a second thought.
The Thedwalls are not alone. Just ask Stephanie Trendowski.
$9,076.04.
That's the ambulance bill for her daughter Emma, who suffered a sudden attack of diabetes and needed to be transported from this hospital in Northwest Indiana to a different one in Chicago. Stephanie says they waited hours for that ambulance to arrive. And when she asked the hospital about just making the drive in her own car,
it has to be in an ambulance. They will not let us take her in our own vehicle to another hospital.
It turned a little and then it turned this way and then it went to the hospital.
For Emma, the ambulance ride was an adventure. For her mom, it turned into an ordeal after the insurance company paid only a few $100s, leaving her with a huge balance.
It was shocking to see that it was almost $10,000 to take my child 37 miles from one hospital to the other that we could have easily done ourselves.
How much of that did your insurance company cover?
$0. The whole thing is our responsibility, yes.
A recent report by the Public Interest Research Group shows ambulances transport over 3 million Americans with private insurance every year, and over half of those are exposed to a surprise bill. That surprise comes months later when insurance companies deny coverage because it was an out-of-network ambulance, leaving patients stuck paying the balance.
That's outrageous.
And it's not supposed to be this way. 3 years ago, Congress passed the No Surprises Act to protect consumers from surprise medical bills. Hospitals, emergency rooms, and air ambulances are all included in the law. But ground ambulances are not, sticking millions of Americans like these with surprise bills.
Everyone knows ambulances are expensive. You don't get a choice. The ambulance that shows up, shows up. Why wouldn't it be covered?
Turns out Congress did not want to mess with an already messy system, with some ambulances run by hospitals, some by cities and towns, others by private companies, with a patchwork of local and state laws that often provides little oversight. So it's now up to ambulance companies and insurance companies to battle it out.
We did our job. but the insurance companies didn't do their job.
Kim Godden is a vice president at Superior Ambulance, the company that transported both Teddy and Emma. She says the $9,000 for each transport is justified because of the high level of care, the distance traveled, and rising labor and fuel costs. And she says many insurance companies simply won't work with ambulance services to cover those charges.
If insurance isn't going to cover an ambulance transport, what do you need insurance for? All we want is fair negotiations. It's America. We just want fair negotiations that we shouldn't be taken advantage of.
But some insurance companies say it's the ambulance services that are taking advantage by charging exorbitant rates. The insurance company that denied coverage for Emma's ambulance ride is Anthem Blue Cross and Blue Shield. The company told 13 News Superior charged the Trendowskis 8 times what Medicare would have paid for the same service. And it said for the past year, Anthem has talked with Superior Ambulance about joining our network so that our members would be protected from these inflated out-of-network charges, but they have chosen not to join the network. The two sides are now at a standstill when it comes to covering Emma's ambulance ride. It's a battle that happens all over the country every day with consumers stuck in the middle.
We are working to solve that problem.
Patricia Kelmar is on a federal advisory committee that's now studying ambulance surprise billing.
We are going to be working then with Congress, sharing the report and really asking for strong protections and to do it quickly.
Some parts of the country are taking action now. 14 states have recently passed their own laws to ban surprise billing by ambulance services. Indiana is not one of them.
You have neighbors on both sides of you, Illinois and Ohio. They are both protecting patients from ambulance surprise billing. So there's a nice big gap in the middle there, and we'd love to see some kind of action on the state level to protect patients from ambulance surprise bills.
Emma's family did not get that kind of protection. Neither did Teddy's. So they're now trying to warn other families about the kind of surprise nobody wants.
People can't afford this.
It should never cost that much for such a simple ride.
The Trendowski family is still fighting their medical bill. The Thedwalls used a private company to appeal their insurance denial, and it worked. The insurance company just changed its mind and will now cover the whole thing. Want to see how you can fight back against these kind of medical bills? We've got that online at WTHR.com. I'm Bob Siegel, 13 Investigates.